I'm Sam Roberts of the New York Times, and welcome to the New York Times Close-Up. This week, I'll talk with Manhattan Borough Historian Robert Snyder. His new book, When the City Stopped, Stories from New York's Essential Workers. The book captures the resilience of New Yorkers during those trying times that began 5 years ago this month in the pandemic. But first, let's discuss the city's ongoing issues with New York City Public Advocate Jumaane Williams. He's been making headlines on immigration, city spending, and the future of Mayor Eric Adams. Welcome and thanks for joining us. You have said you're running for re-election. We should remind our viewers that you are next in line to the mayor if anything happens to him, if he should be resign or fired. You also have said Brad Lander, who is the controller running, you would rank him first or second in voting. Last week you said Adrienne Adams sounds like she knows how to run a city. Who should be the next mayor?
That's a long question, but I appreciate being here. As you mentioned, I'm running for re-election. I'm on the dream team. Don't rank Eric or Andrew for mayor. So that's my big goal. I have said I'm running for re-election. I think the mayor has tried to deflect criticism by telling folks I just wanted to be mayor, which is just not a true statement. For those who don't know, I'd be mayor temporarily until an election was called, so it's not like it benefit a great deal. I've been very clear. Brad Lander and I have worked together on a lot of issues. Definitely said earlier I rank him number one and number two. And I'm excited about Adrienne Adams, who's jumped in the race. I think she has a lot to offer. And she had a great fundraising haul for just a 5-day haul. So I'm impressed by her and the campaign. There's also a lot of great folks running, so I'm have to round out what the rank would be altogether. But I do know that we have to move past this administration as quickly as possible, and we don't want to leave a mayor who's in crisis and replace them with someone who left their position in crisis.
If the judge throws out the charges against Mayor Adams with prejudice, meaning that he doesn't have that lever over him anymore from the Trump administration, and when you look at his substantive record, city of yes, as he called it, deregulating a lot of things, the rezoning for more affordable housing, why do people think he's been such a bad mayor?
Well, one, I want to be clear, and I'm just honest about this, as a black man who's a citywide elected official, it's very difficult to watch another black man who's an even more powerful citywide elected official make the errors I think that have happened, and that's been painful.
What errors?
So there's a few, right? And so I have a job to do as public advocate, and that's to really push that. But I want to be clear, even when we look at the charges that are on the federal level, one could look at the things that we agree happened. There's no discussion of whether it happened or not. And you can make an argument whether or not it should have been charged and been the federal government. And he also has a right to his day in court, period. And so we always have said that. There's several things. In this case, if the judge, which it looks like, will dismiss it, it wasn't over innocence or guilt. So we never got that question answered. It was just that they literally said they want to make sure he can help.
Technical or political?
Yes, he can. They literally said they want to make sure he can help with things like immigration for the White House. We also have to be clear of, in my mind, with the things we agree on, it seems to be a long pattern, at minimum, of consistent poor judgment. And we've seen that consistently. And that's a problem. And then we've seen the response to this, which is acquiescing to things that are going to be very harmful to this city. I think any mayor can point at things that they have done well, and that's the same for this administration. I do think sometimes when you look even more deeply, well, what is the thing we're championing? And so I think there has been a good conversation about the amount of jobs that have been created, but then when you see that we've doubled the poverty rate of the nation, we haven't moved the poverty line at all, it's gotten worse. Then we have to look at that in the context.
Isn't it better to have a mayor who gets along with the president?
Well, so let me be clear about this. Whoever is the mayor, whoever's elected officials, you have to try to work with the president, whomever is there. So that is not what the problem is. The problem is also when someone is doing things that are going to harm the city, you have to be very clear that you're going to speak up and say, this is a problem for our city. This is a problem for New Yorkers. We have a mayor who literally said that he will not say anything bad about any policy that's coming out of the White House. That doesn't make any sense. And we see a lot of policies that are coming that are harming New York City. They're going to make it harder for us to be safe, to feel safe, and to be affordable city to live in. The mayor should be the first cheerleader, not the one saying that they won't. And there are a lot of spaces where we haven't seen the movement that we wanted to see. You know, the mayor and I used to have great conversations about what public safety is and isn't. And it's been disappointing not to see some of those things play out. And if you ask the city if they think crime is an issue, and do we think law enforcement are partners in trying to address that, most people would say yes. If you ask the third question, do you think they can do it alone? Everyone would say no. And that third question, we had great opportunities to provide infrastructure so that wasn't the case, and we failed miserably. And that's just one issue.
Why not Andrew Cuomo? He would stand up to Trump.
So I think we have angry voter syndrome, where we are trying to elect similar people, in this case, the same person who was harmless before, whether it is the White House or now in City Hall. Andrew Cuomo have made a lot of harmful decisions, including what happened to the MTA. He pretended that he wasn't in charge of the MTA, he was, including cutting psychiatric beds. So people are upset about what's happening with mentally ill New Yorkers. The governor himself cut psychiatric beds. He cut homeless services. He was trying to cut Medicaid in the middle of the pandemic. I used to fall into the trap of thinking, even though he was a bully as a leader, maybe he was a great manager. All that went to the wayside during the pandemic. And if you dissect the decisions that were made, they were actually harmful to New Yorkers and New York City in particular.
Was the problem there the substance? A lot of people didn't know what to do. A lot of mistakes were made. Or was it what some people call the cover-up, not admitting what went wrong?
I think it's both. It was very difficult. I mean, this was such a hard thing to be trying to lead. What was worse is see politics come to play. And so whether or not you agree with the shutdown, which I think we had to do, I remember there were 3 days where the governor was deciding whether to do the shutdown, not because he believed we should or shouldn't, but because he wanted a new name, because Bill de Blasio decided to call it one thing, and he said he didn't want to call it that. We lost lives. You can go back and do the research. We lost lives because he waited. The decisions about the nursing homes, he still won't admit there were any errors. According to him, he didn't make any mistakes. That is not a good sign of a leader. The number of people who died happened to coincide with the book he was writing. This is before you get even to the scandal that why he had to leave office. And so there's a lot of reasons for the communities in general, black and brown communities in particular, why you would not want an Andrew Cuomo as the mayor of this city. You
talk about the homeless, mentally ill. Should they be committed involuntarily?
The short answer is some people have to be. There's no way to have to address this without that tool being available, which it is. So I'm never quite sure why we're pretending that you can't involuntarily hospitalize people right now. That's a tool and a tactic. It's not a plan. And so one of the biggest issues is right now is that many of the folks who we see who obviously have mental health issues is the continuum of care. And so you can say, okay, let's involuntarily hospitalize them for 3 days or 2 months. If they don't have a continuum of care once they get out, what's going to be the problem? We know what the problem is. We know what the infrastructure is that we need. We need funding and a will to actually do it so we can connect folks with care after they've left the hospital.
It seems pretty obvious. Why isn't that will there?
That's a great question. And it's a very frustrating one when I hear executives who say all we need to do is send National Guard or law enforcement to the train station. And I'm like, well, sometimes you need that, but what else are you going to do? Because it's a resource. At some point, you're going to pull them back. And second of all, are you going to put one on every train station, every car, and every square inch? There are people who need assistance, so what are you doing to get that assistance? When you have a Cuomo who's cut the psychiatric beds, when you have people who are pretending that all we need to do is involuntarily commit people for longer, they're not being honest. Rikers Island now is the largest mental health institution in New York, probably in North America. That doesn't make sense, and we all know it. And so we have to have leaders that will not only put the money, because you can't just throw money in a situation, that will build out the infrastructure that's needed That is harder to say in 30 seconds when you're running for office.
It looks like Rikers Island will not close by 2027, which is the official deadline. How would you fix it?
For me, the shocking thing is not that it won't close on time. Unfortunately, many plans of the city and government don't go to plan. What's been stressful for me is we have the mayor that didn't even want to try. And so he's made it as difficult as possible. He didn't want to actually try to execute a plan. It's one thing, try to execute a plan that doesn't hit deadline. It's one where you're not even trying and saying we can't do it. And so, again, this is something where we need the political will. And we also want to make sure that we're not replacing borough jails with a culture from the one that's Rikers. So we can't just be replacing the culture in 4 different ways. And we have to do it a lot differently. I think there's a plan in place. Here's another place where I think Speaker Adrian Adams has led. By the way, she deserves to get credit along with the City Council for City of Yes. They're the ones that actually made it and fine-tuned it so we can get past. But you have to have a willing partner. And in so many of these instances, the mayor has blocked things. Even when the City Council under leader Speaker Adams, Adrian Adams, passed laws to help people get more housing vouchers. It's the mayor who's blocked it. And so many ways he's been a blockage to so many things. And by the way, I do want to bring back to Andrew Cuomo, many of the things that he's now saying he would fix, he's the one that made worse. So the angry voter syndrome is tough to watch, and I don't know if people are recognizing within ourselves, we're angry, we're hurt, and in that situation, I think we're looking at things that have harmed us in the past.
You talk about the role of law enforcement in making the subway safer. Should we add cops or defund cops?
Well, just so we're clear, NYPD was never defunded. Almost every other agency was. And so we never had a real conversation of what a defunding HPD, defunding the Department of Youth and Community Development, what the impact that has. The issues with law enforcement is sometimes when we have lazy leadership and we don't want to actually do the things like build out a continuum of care for people who need assistance with mental health, let's just throw our cops at it and see how long it takes for them to do something. And actually, at the end of that is, unfortunately, something that hits the news. So we're at about 10 surges that I've counted since the de Blasio era. And each time I would say, what else are we doing? Because if you have to put 10 surges of law enforcement, you have to put 2 surges of the National Guard, something else is wrong. And so I know that it is easier, particularly if you're running for office, to stoke fears and be tough on crime. I want us to be serious about safety. And being serious about safety is saying, yes, sometimes when there's an acute problem, we have to send our law enforcement to quell that problem. But being serious about safety is figuring out what is the issue to begin with and how do we assist. Our law enforcement can't fix mental health issues and they can't fix housing and homelessness issues. And you keep putting them in bad situations because they don't have tools to solve this and putting community in bad situations. And we know this. And we have to elect leaders that can actually execute what people already know.
How can we build more affordable housing when we need money from the state and the federal government, which is unlikely to be forthcoming?
Well, one, something is affordable to everyone. And so we want to talk about income targeted housing.
Right.
But
affordable is a very subjective
That's
term.
correct. I would say, though, there's no plan on housing that's real if it's not at least 60% of preservation. And so we have to preserve the quote-unquote affordable housing we have, whether it's Section 8, Michelama, NYCHA, rent regulation. We have to preserve that. And so we have to do a better job of preserving because we've lost those. Now, we do have to build. And we want to make sure when we're building that we are building at the income targeted level that needs it the most. I will say when I ask anywhere across the city how many people think housing and homelessness is an issue, how many think that in order to address that you have to get housing where people can afford it, they raise their hand. How many people want to live next to a taller building? That question is answered the same. The most Republican, the most Democrat.
Tough to reconcile density and affordable housing.
So that's correct. And so we sometimes know what we have to do. It's difficult to do it. But I do know if the city looked the same way it did 100 years ago, we wouldn't be here. And if it looks the same way in 100 years, our children's children probably won't be here because they won't be able to afford it.
Speaking of what should be done, the mayor dismisses your criticism. He says you're a naysayer. He says, I don't even know what the public advocate does. Very quickly, what does a public advocate do?
Well, he should know what the charter is because he ran for mayor. But there's 5 or 6 charter mandated duties, including introducing legislation. You're an ombudsman. You have to make sure that the charter is being respected by all agencies. You get to appoint people to committees like CCRB, Planning Commission. You have a vote on the pension board. You're executive director of an organization called COPIC, which is about public information. And you get to use your bully pulpit. I am proud because we've passed more pieces of legislation than all the previous public advocates combined. I wanted to show that you can use the activism on the street, lift up, use the media to raise attention, and get things done. I think the mayor is confusing naysayer with actually trying to get the city to be in the right direction. And my job is to make sure I'm pointing that out, no matter who is the mayor. And I think we do that job very, very well.
Jumaane Williams, the city's public advocate, thank you for joining us.
Thank you.
Coming up next, a look back at the COVID-19 pandemic through the eyes of the New Yorkers who kept the city running. This month marks the 5th anniversary of the first confirmed COVID-19 deaths in New York City, a somber reminder of the pandemic's still resonating impact on the city. Dr. Robert Snyder, appointed Manhattan Borough Historian by Gail Brewer in 2019, keeps the post. He joins us now to discuss his new book, When the City Stopped: Stories from New York's Essential Workers. It's a tribute to those who kept the city running during its darkest days. Robert, what's going to be the legacy of this pandemic? Hardly anyone remembers the flu epidemic of 1918 and 19. I'm not sure there's even a memorial to the tens of thousands of people who died during that. How are we going to remember this one?
Well, I fear that people will either forget it or remember the irritations and not the great dangers that we faced and the sacrifices to overcome them. People remember masking, they remember confusion over social distancing, but what they don't forget is the work of essential workers like transit workers, healthcare professionals, people who work behind cash registers. Those are the folks who stayed on the job because they worked in essential positions, and they kept the city running through a very bleak time.
Is there a lesson we learned from all of that?
Yeah, I think that sometimes it's important to put the common good over your own individual good. And essential workers did that again and again. Sometimes they were motivated out of professionalism, sometimes out of loyalty to workmates. Sometimes they went to work because they had to pay the rent. But they served a larger public purpose, and they kept the city going in a very difficult time.
And did the rest of the city appreciate them?
There were nightly cheers, and it was great to see that. Mm-hmm. You would have people hanging out their windows at 7 p.m. I participated in them. But at the same time, you could get some folks who were not always appreciative. I'll give you an example. Passengers on buses and subways could be sometimes disdainful towards transit workers. And I interviewed a transit worker who was knocked unconscious by a man after the bus driver asked the man to put on a mask.
Are there any people, a lot of the book is collected oral histories, narratives that other people experienced. Is there anyone you wish you had been able to interview?
I tried to get a funeral home operator because funeral home operators were overwhelmed. Mm-hmm. And the restrictions on funerals and gatherings really diminished the community sense around mourning the loss of a death. I couldn't get a hold of one. I made a lot of calls. And in the end, the hardest thing was extracting from more than 400 interviews, narratives, and poems, the 40-odd that I ran in the book. That was the challenge, really.
It's always good to have more than less, though.
Yes.
What about schools and school children? How badly, if at all, were they affected by the fact that schools were closed for so long? Distance learning, as it was called.
It was very tough on the students. It was very tough on the teachers. I have an interview with a public school teacher in Queens, Damian LaRock. He worked in the epicenter, and he had all the challenges of trying to connect with his students online, but he also faced the challenges that a lot of his students had suffering at home. Family members were sick. Sometimes the families needed food. Sometimes they needed clothing. A lot of kids lived in households that were crowded with lots of people there. So it was not easy for them to go to school online, although that's what they were tasked with doing.
A question with political implications. Obviously, Andrew Cuomo was governor. We thought he had done a very good job of being the public face of government response. Did he do a good job or not? And what impact did sending patients to nursing homes really have?
He did a good job of reassuring people in very bleak days. At the same time, he wasn't always listening closely to public health advice. He and the mayor dithered and dickered while the pandemic was racing through the city, and that harmed the city's response to the pandemic as well. So it depends what people remember about Andrew Cuomo. If they remember his television briefings, which were very reassuring, I think that boosts him. If they remember the scandal over the nursing homes, if they remember the delayed response in the beginning, that's going to hurt him.
You said that people yearned for a world without COVID and where the lessons would be applied to build a better city and country. Did that happen? Did we learn lessons?
No, I was shocked. I was shocked at how quickly people wanted to forget the pandemic. I thought that the era of 1918 was forgetting about the flu so quickly. But I think people reached for that kind of forgetting quickly after COVID. I think they wanted to forget the trauma and remember what was bearable, which was inconveniences.
You said that New York, of course, had a great medical system, which it certainly does, but not a great social democratic system. What do you mean by that?
It means that private hospitals have better sources of funding, better facilities for patients. If you had to go to a public hospital, which had weaker funding, more problematic facilities to work with, then you were in a much more difficult place. For me, the single biggest thing that the pandemic revealed at the start was the inequality in New York City today. I was aware of that. I'd written a book about immigration. We made it one of the biggest themes. But the inequality between quality of health care that people received was one of the things that really bothered me a lot.
In the book, you quote two people who one would not necessarily think of quoting in a book about the pandemic, George Orwell and Marc Bloch, the French resistance fighter. Why them? What did they have to say?
Marc Bloch, because he was a genius of a historian who wrote about medieval France. In World War II, despite his advanced age, he served in the French resistance. He was bewildered that France had collapsed so quickly in face of the Nazi onslaught, and he wanted to understand why. He wrote a book called Strange Defeat to explain that phenomenon to fellow Frenchmen. And I hope that my book, down the years, becomes a way of beginning to understand how we did so badly in COVID. George Orwell, because early in the days of World War II, he looked at Britain's situation and he said, Britain has to become a more democratic and a more egalitarian country if it's going to defeat Nazi Germany. I think we need to become more democratic and egalitarian to do better in the next health crisis.
Two of the legacies of COVID, people are still afraid of the subway. A lot of people still haven't gone back to work. They're still working at home. Where's that going to go? Is that going to change over time?
The subway can be fixed, I think, with the right amount of policies and money. The big challenge is how we work and how we live in New York City. And that's going to be a big problem. That's going to affect everything from commuting to tax revenues to our public school population. If we can't get the city's population back up, it's coming back up. But if we can't get the public schools population back up, then the system might shrink. And I think that could be a real problem for the people who have to endure that shrinkage.
Where are those students going?
Some of them are not in the city anymore. They left, right? Some of the people who are replacing them are younger, more affluent residents of New York. They're not necessarily putting their kids in public school right away.
You said that Black and Hispanic New Yorkers bore a disproportionate share of the burden of the pandemic. Why was that, and who allowed that to happen?
They inherited inequalities that had been there in the city for decades, and that had to do with everything from health care to how they lived, sometimes in multi-generational housing, right? Where a person could get infected and come home and infect their parents and grandparents at the same time. It's also true that they were more likely to be essential workers. I read a fascinating statistic. If you're a Black or Hispanic, you're more likely to know somebody who is an essential worker. And I think that shows the degree of exposure.
That's interesting. Social distancing you describe as an oxymoron. My wife said I've been waiting for social distancing all my life. But why is it an oxymoron? And did people, in one sense, become closer as a result of the pandemic?
Well, the problem with social distancing is we're all doing it, but we're all pulling apart from each other. And I think people yearned for contact. I think the 7 p.m. cheers were great for the essential workers, particularly the medical workers who are out there. But I think people enjoyed looking out their windows and seeing their neighbors. I used to yell to a woman across the street from me. I'd never met her before or since, but we would lock eyes in the middle of those cheering sessions.
Interesting. And that has not endured, has it?
No, those died. I think the break point in the pandemic was the introduction of vaccines. On one hand, it broke the back of the pandemic. It was no longer as deadly as it had been. We were no longer losing about 800 people a day. But once the vaccines came in, the glitchy enrollment procedure to get your shot, followed by the fact that the results, while great, didn't completely eradicate COVID, that rattled people and set off disputes about vaccination that made for a more sour experience.
Robert, you alluded to the book you co-wrote about immigration, All the Nations Under Heaven. We have always been ambivalent about immigrants in New York. We welcome them on the one hand, we sometimes resent them on the other. What's different between the immigrants who came before and, say, the migrants we're talking about now?
Two things. I mean, one is the people who are coming to the United States now and coming to New York City tend to come more from Latin America, Asia, and Africa. As much discomfort as previous generations of New York had with European immigrants, they were dealing with other white people.
Well, but we didn't consider Jews, Italians, some others white at the time of certainly the end of the 19th century.
That's true, but over time they could make progress and get considered white people. It was hard for everybody, but they got into that status eventually. I think now the fact that you do have people coming from the global south coming into the city, you also have a situation where immigrants are being demonized at the top of the federal government. And finally, it is hard to absorb new immigrants into the city, and we don't always have the tools ready to do that. I'd love to see new immigrants and migrants get housing right away so they can settle in and get to work. They want to go to work. That's what they ought to be doing. We need their labor. But if we lose it, we won't get the boost from them that we could otherwise obtain.
And of course, that's what immigrants have always done in the city's history.
Immigrants coming to New York City in the 1980s helped us climb out of the urban crisis of the 1970s. Immigrants can help us climb out of the post-COVID doldrums again if we give them an opportunity.
Thank you, Robert Snyder, the author of When the City Stopped, Stories from New York's Essential Workers During the Pandemic. That's it for this edition of Close Up for the New York Times and CUNY TV. I'm Sam Roberts. And don't forget to download the CUNY TV app. You can catch our weekly program on the go, anytime, anywhere.